Welcome to our channel. Today, we are diving into an important and timely topic, the psychological factors associated with long COVID, also known as post-COVID-19 condition. As the COVID-19 pandemic continues to affect millions worldwide, understanding the long-term impacts of the virus is crucial. Long COVID is a term used to describe the lingering symptoms some people experience after the acute phase of the infection has passed. These symptoms can last for weeks, months, or even years. Before we dive deeper, it's important to note that we should not reduce these symptoms to being purely psychological or mental. Instead, we must understand the complex interplay of various factors influencing these symptoms and the illness. Today's discussion is based on a systematic review and meta-analysis, which is a comprehensive study that combines data from multiple research studies to provide a high-level overview of existing evidence. This particular study aimed to synthesize current evidence on psychological factors potentially associated with long COVID and condition-relevant outcomes like symptom severity, impairment, quality of life, and healthcare utilization. The study included 113 research articles involving 312,831 patients with long COVID. The researchers focused on a wide range of psychological variables, but the most commonly studied factors were depression and anxiety. Key findings from the study: 1. Depression and anxiety. The study found that people with long COVID are significantly more likely to experience higher levels of depression and anxiety compared to those who have recovered from COVID-19 without lingering symptoms. The odds of experiencing depression were more than twice as high for individuals with long COVID. Similarly, anxiety levels were also significantly higher in these patients. 2. Association with long COVID. Depression and anxiety were found to be significantly associated with long COVID. This means that individuals with higher levels of these psychological conditions were more likely to suffer from persistent symptoms. The analysis showed that these psychological factors are not just common in those with long COVID, but also likely play a role in the persistence and severity of symptoms. 3. Predictive factors. Interestingly, the study also highlighted that pre-existing conditions like depression and anxiety could predict the likelihood of developing long COVID. This suggests that individuals who had higher levels of these psychological conditions before contracting COVID-19 are more susceptible to experiencing prolonged symptoms. Understanding the role of psychological factors. The relationship between psychological factors and long COVID can be understood through the biopsychosocial model. This model posits that biological, psychological, and social factors all interact to influence health outcomes. In the case of long COVID, the physical symptoms of the virus, such as fatigue, pain, and shortness of breath, can contribute to psychological distress. Conversely, psychological factors like stress and anxiety can exacerbate physical symptoms, creating a vicious cycle that is hard to break. Health anxiety, or the excessive worry about having or developing a serious illness, can lead individuals to focus intensely on bodily symptoms, often interpreting normal sensations as signs of severe illness. This heightened focus and concern can amplify the perception of symptoms, making them more distressing and harder to manage. Emotion regulation, or the ability to manage and respond to emotional experiences, also plays a crucial role. Poor emotion regulation can lead to increased stress and anxiety, which can in turn worsen physical symptoms. Conversely, effective emotion regulation strategies can help individuals manage their symptoms more effectively and improve their overall well-being. Moreover, the experience of long COVID itself can lead to psychological distress. The chronic and unpredictable nature of the condition, combined with the lack of clear treatment options and the impact on daily life, can contribute to feelings of frustration, helplessness, and despair. Social factors, such as support from family and friends, also play a significant role in how individuals cope with long COVID. Strong social support can provide emotional comfort and practical assistance, helping to alleviate stress and improve psychological well-being. Stress and long COVID. Stress is another significant factor that can influence the persistence and severity of long COVID symptoms. Chronic stress can weaken the immune system, making it harder for the body to fight off infections and recover from illnesses. Additionally, stress can exacerbate symptoms like fatigue, pain, and cognitive difficulties, which are commonly reported by those with long COVID. Stress management techniques such as mindfulness, meditation, and relaxation exercises can be beneficial in reducing stress levels and improving overall well-being. Mindfulness involves paying attention to the present moment without judgment, which can help individuals manage their stress and anxiety. Meditation can help calm the mind and reduce stress, while relaxation exercises, such as deep breathing and progressive muscle relaxation, can help release physical tension and promote a sense of calm. The role of physical activity. Physical activity is often recommended as part of a healthy lifestyle and can have numerous benefits for both physical and mental health. However, for individuals with long COVID, physical activity can be a double-edged sword. On one hand, regular physical activity can help improve mood, reduce anxiety, and enhance overall well-being. On the other hand, some individuals with long COVID may experience post-exertional malaise, where physical activity exacerbates their symptoms. It is important for individuals with long COVID to find a balance that works for them. Gradual and paced physical activity, tailored to the individual's tolerance and energy levels, can help improve physical function without worsening symptoms. Consulting with healthcare providers and physical therapists can help develop a personalized exercise plan that considers the individual's unique needs and limitations. Sleep disturbances are common among individuals with long COVID. Poor sleep can contribute to fatigue, cognitive difficulties, and mood disturbances, further exacerbating the overall burden of the condition. Improving sleep hygiene can help enhance sleep quality and overall well-being. Here are some tips for better sleep hygiene. First, establish a regular sleep schedule. Go to bed and wake up at the same time every day, even on weekends. Next, create a relaxing bedtime routine. Engage in calming activities such as reading or taking a warm bath before bed. Also, limit exposure to screens. Avoid using electronic devices such as smartphones and computers before bedtime, as the blue light can interfere with sleep. Additionally, create a comfortable sleep environment. Ensure your bedroom is cool, quiet, and dark, and invest in a comfortable mattress and pillows. Finally, limit caffeine and alcohol. Avoid consuming caffeine and alcohol in the hours leading up to bedtime, as they can disrupt sleep. Nutrition and long COVID. A balanced diet is essential for maintaining good health and supporting the body's recovery. Nutrient-rich foods can help boost the immune system, reduce inflammation, and provide the energy needed to manage daily activities and symptoms. Here are some dietary tips for individuals with long COVID. Firstly, eat a variety of foods. Include a mix of fruits, vegetables, whole grains, lean proteins, and healthy fats in your diet. Secondly, stay hydrated. Drink plenty of water throughout the day to stay hydrated. Thirdly, limit processed foods. Reduce your intake of processed and sugary foods, which can contribute to inflammation and fatigue. Lastly, incorporate anti-inflammatory foods. Foods rich in omega-3 fatty acids, antioxidants, and vitamins can help reduce inflammation. Examples include fatty fish, nuts, seeds, berries, and leafy greens. The importance of holistic care. Addressing long COVID requires a holistic approach that considers the physical, psychological, and social aspects of the condition. Integrating medical care with psychological support and lifestyle modifications can provide comprehensive care for individuals with long COVID. Healthcare providers should work collaboratively with patients to develop personalized care plans that address their unique needs and challenges. This may involve a combination of medical treatments, mental health support, physical therapy, and lifestyle interventions. Supporting research and advocacy. As we continue to learn more about long COVID, ongoing research and advocacy are crucial. Supporting research efforts can help uncover new insights into the condition, identify effective treatments, and inform public health strategies. Advocacy efforts can raise awareness about long COVID, reduce stigma, and ensure that individuals receive the support and resources they need. Conclusion. The psychological factors associated with long COVID are complex and multifaceted. Depression and anxiety are significant contributors to the persistence of symptoms, and addressing these factors is crucial for comprehensive care. By understanding and addressing the psychological aspects of long COVID, we can improve the well-being of those affected and help them on their journey to recovery. Recognizing the interplay between physical and psychological factors can lead to more effective treatments and better outcomes for individuals with long COVID. Mental health support, stress management techniques, social support, healthy lifestyle choices, and holistic care are all essential components of managing this condition. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more content on health and well-being. Stay safe and take care.